we're so excited to be at IMMH this weekend. I am here with Dr. Chapek. Dr. Chapek is one of our favorite doctors. He's here. He's a naturopath physician at Amen Clinics. He's been with us for about 7 years. We love him. We're going to talk a little bit about Dr. Chapek's speech and what he's going to be talking to all these awesome people at IMMH this weekend. Hi, Dr. Chapek.
Hi.
Thanks for being here with us.
Good to be here.
So let's talk about your speech this afternoon. So you're going to be talking about TBI and concussion.
Right.
What's going on?
What's going on? Well, concussions and brain injury are a significant cause of mental health problems.
And nobody knows about it.
And nobody knows about it because we don't look at the brain. And we kind of minimize concussion. So you hit your head, you're dazed, and then you go about your day, and you don't always have symptoms immediately. That's the biggest thing. So some sports concussions, we're sort of programmed to shake it off, get out there again, and that causes serious damage, especially if you hit your head again.
Yeah, correct.
Yes.
That's scary. I mean, I know through our imaging work, we've seen brains of people that have been, whether they're soccer players for a long time, whether they play tackle football, whether they just fall off their bike, and we've seen immense amount of damage. But I guess the exciting information about that we've seen through our research is that there's something you could do about it.
Right.
Are you going to talk a little bit about that in your speech today?
Yeah. My main 3 points of the talk, simple. So first is that concussions and brain injuries are a significant cause of mental health problems. 2, that, like you said, it's not known about because we don't look at the brain. That's why we need to do imaging, and also we need to do testing. And 3rd is that it's not approached correctly, or there's not enough support. We don't facilitate healing for the brain. We don't support healing for the brain like we do for a twisted ankle. So you go out, you twist your ankle on the field, or just walk into your car in high heels or something. You twist your ankle, and everybody knows you do RICE, rest, ice, compression, elevation, for the swollen ankle, there's heat. But when you damage your brain, you don't see the injury, you don't see the swelling, but it's still happening.
Right.
And so my whole idea is that we need to both have an approach for acute brain injury that's different, that we have a protocol to help heal immediately, even if we can't see the injury. So that's one aspect, is acute injury. The second is for chronic, so those people who have had depression for years or anger problems, and it's actually due to a past injury, and maybe they didn't lose consciousness, kind of injuries. People think of injuries if they've been to the hospital, or they've been life-flighted to a hospital, or they've lost consciousness. That's what they see as an injury, but it's really, you can have injury without losing consciousness. And so those people who have struggled for years, or people that have had an injury and haven't gotten better. And the reason I wrote a book, Concussion Rescue. It's going to come out in February. And the whole reason I wrote this book is because I gave a talk at a brain injury conference about 4 years ago. And afterwards, people came up to me, there's so much research, I didn't know about that. Patients who hadn't recovered, and doctors who needed to know. So that's why I wrote the book, is because people need to know about this.
No, and Dr. Amen says this a lot too, but concussion, TBI is a huge part of people not being able to fully recover because, they might have had a fall, they might have had something happen in their life, a car accident, and like you said, they didn't lose any, they didn't black out, they didn't lose consciousness, but something in their life has been completely different because of this accident. But the exciting news is that there are things that you could do about it, and we are really excited for your book. Before we started talking on camera, I asked you, is there anything specifically that's happening in medicine, whether it's at this conference or just in general, that you're really excited about that you want to share with our viewers?
One of the things I'm really excited about is the realization, we're starting to see the realization that in research and in the approach to complicated conditions, especially brain-related conditions, that it's not just one thing that's going to help. It's not just finding one supplement like curcumin or just taking fish oil, high dose. We're all beginning to recognize that it's more of a comprehensive programmatic approach that's going to help, and that's my whole idea with treating concussions, and that's Amen Clinics philosophy, and that's why I love what we do, and Dr. Amen's philosophy of looking at the whole person, treating the cause, that fits in line with naturopathic medicine. So that's what gets my engine revved up in the morning to come to work and to figure out with people what are all of the specific factors that might be affecting your individual problem, whether that's depression or anxiety. And so, I don't know. That's what gets me going in the morning.
Well, we love that. Well, thank you so much for being with us. And we're at IMMH. We're going to talk with Dr. Amen next. Thanks, everyone.